Hi, I'm Linda, creator of information about arthritis. If you are new to this channel, then don't forget to subscribe. Just click the subscribe button below and then click the notification bell to receive notifications of new videos when they are released. Also, don't forget to visit my website, Food with Arthritis, where you can find out more about these terrible diseases and download free articles. In Denmark, a study was done between 1997 and 2008 that involved children born to mothers with rheumatoid arthritis. At the time of the pregnancy, the babies had a 90% increased risk of developing early childhood epilepsy. Babies born to mothers with rheumatoid arthritis were not yet diagnosed during the pregnancy, but were diagnosed after having a 26% increased risk of early epilepsy. But this is not a simple genetic effect, as there was no increase in the risk of epilepsy in the baby whose father had rheumatoid arthritis. The same study found that there could be changes to the baby's developing brain if exposed to the mother's autoantibodies during the pregnancy. More research is being done on linking rheumatoid arthritis, type 1 diabetes, lupus, ulcerative colitis, and some types of epilepsy. Patients that have rheumatoid arthritis have a higher rate of developing epilepsy. Therefore, people with rheumatoid arthritis are encouraged to get treatment for relieving pain as early as possible to help reduce the risk of epilepsy. Thus, slowing down the development of epilepsy. Slowing down the progression may mean that you could be using non-steroidal anti-inflammatory drugs longer. Studies showed a significantly high risk of epilepsy in a patient with rheumatoid arthritis, who had non-steroidal anti-inflammatory drugs for 560 days, the risk decreased. Early findings have shown that an increased risk for epilepsy revealed that there is a connection between rheumatoid arthritis, also multiple sclerosis, and other autoimmune diseases. Epilepsy can be cured. About 6 out of 10 people that are diagnosed with epilepsy can be seizure-free within a few years with treatment. Some people may have occasional breakthroughs or side effects of the medication, and others could have uncontrollable seizures. An estimated 25% of people with epilepsy could be potentially preventable. Preventing head injuries, reducing falls and sports injuries, etc., can prevent post-traumatic epilepsy. Adequate prenatal care can reduce new cases caused by birth injury. Prevention or the control of high blood pressure, diabetes, and obesity. Avoid smoking, tobacco, and excessive use of alcohol. The prevention of rheumatoid arthritis is mostly the same as epilepsy. Avoid smoking, tobacco, and excessive use of alcohol. Prevention or the control of high blood pressure, diabetes, and obesity. Eat a healthy diet. Exercise each day. Avoid high salt and sugar. Eat more fish. Avoid fizzy drinks. Avoid environmental chemicals. Epilepsy is not contagious, also it can be cured. Epilepsy can be divided into categories: structural, genetic, infection, metabolic, immune, and unknown. You may be at high risk if any of the following occurs: loss of oxygen or trauma during birth or low birth weight. Congenital abnormalities. Genetic conditions such as brain malformations. A severe head injury. Stroke can also restrict the amount of oxygen that is to the brain. You could have an infection in the brain that could cause meningitis, neurocysticercosis, or encephalitis. You could have a genetic syndrome or brain tumor. Rheumatoid arthritis is an autoimmune disease, which means that it's caused by your immune system attacking your healthy body tissues. But it's not known what triggers this. The cause is that your immune system usually makes antibodies that attack bacteria, viruses, or infections. If it does not work properly, your immune system mistakenly sends antibodies to the lining of your joints, which attacks the tissue surrounding the joints. The thin layer of cells, called synovium, that cover the joints becomes sore and inflamed and releases chemicals that damage the following. Cartilages are stretchable tissues that go between the bones. The tendons are tissues that connect the bone to the muscle. Also, the ligaments are tissues that connect bone with cartilage. Seizures can be controlled with the appropriate use of anti-seizure medication. However, It is possible to discontinue the anti-seizure medicine after 2 years without seizures, considering certain clinical, social and personal factors. But in low-income countries, around 3/4 of people with epilepsy may not get the treatment they need, which is called the treatment gap. In middle-income countries, low availability of anti-seizure medication is available. A study found that the public sector of low and middle-income countries is less than 50%. In primary health care, the level of epilepsy is possible to diagnose and treat most people. Lastly, surgery may be needed if the response to drugs is poor. People that have rheumatoid arthritis are at high risk of epilepsy. A study found that there is a connection between the two diseases. This study concluded that it revealed an increase in risk for epilepsy among people that had other types of autoimmune diseases, such as multiple sclerosis. It's been estimated that 1 to 7 people out of 20, 5 to 35%, that had a new onset of seizures also could have an autoimmune disease. These autoimmune diseases could include Graves' disease, Hashimoto's thyroiditis, Crohn's disease or ulcerative colitis UC, systemic lupus erythematosus, SLE, or rheumatoid arthritis RA. Rheumatoid arthritis can have trouble with memory loss, attention loss and mental focus. They may forget names or appointments, struggle to find the correct word and have trouble making plans. The pain that rheumatoid arthritis brings may induce seizures that could cause unusual electrical activity in the brain. When you are diagnosed with rheumatoid arthritis, an immune disease that attacks joints and organs, you could also develop epilepsy. More studies need to be done to determine the relationship between these diseases. Still, they found that epilepsy included the existence of diabetes, head injury, coronary artery disease CAD, stroke and autoimmune diseases such as rheumatoid arthritis. The overall result of the study found that the cases of epilepsy remained in the patients with rheumatoid arthritis, and the risk increased with age. For example, patients with rheumatoid arthritis between the ages of 50 and 64 had an increase of 2.12-fold. I am not a medical professional, and the information in this article is for information only. Always consult your doctor if you have any worries. I hope this video has helped, and don't forget to subscribe to my channel and receive notifications when new videos are released.